meeting to order for the Mississippi State Board of Medical Licensure. Everybody please stand up for Dr. Dodson to lead us in the invocation.
Pledge, so. Yeah, yes. And Dr. Loper will lead us in the pledge, yes.
Okay. May we pray. Almighty God, we pause to say thank you for all of your blessings, both seen and unseen. And we pray that you receive the soul of our dearly departed colleague, Dr. Tom Joyner, into your kingdom. And we are grateful for yet another opportunity to do work on behalf of the citizens of Mississippi. And while we're doing this work, may we be reminded of that which you require of us, to act justly and to love mercy. And now let the words of our mouths and the meditations of our heart be acceptable in thy sight, O Lord, our strength and Redeemer. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to express our sorrow at the empty chair this morning and observe the loss of our esteemed colleague and friend, Dr. Tom Joyner, who served as our secretary and chairman of the Rules and Regs, faithful servant. He fought the good fight. As y'all know, he was the past president of the State Medical Association and a good friend and leader, servant, and colleague. And does anyone have any other comments about? Would anyone like to say anything about Dr. Joyner?
Yeah, I'd certainly like to say he's missed. He's a true gentleman, an individual who I take pleasure in calling just a really kind gentleman, soft-spoken, a quick wit, humorous guy, but not boisterous, but certainly wise and someone that I truly respect, and certainly someone who will be missed.
Thanks, Dr. Gibbons.
So, I got a chance to first meet Tom in working with MSMA, and he was actually one of the first presidents who I had a chance to expand my service with MSMA under. And he and I had very different backgrounds, but interestingly enough, we're able to forge a friendship over the years that was very unique and one that was very treasured by me. It was a joy to know him. He was a good doctor, but also a really good human being. And he just really inspired people around him to be the best version of themselves. And I just was always impressed with his kindness and his genuine compassion for people, his love of this wonderful calling that we get to participate in, which is the practice of medicine. Yeah, I'll miss him. And while we had an opportunity to kind of help to share in his burden as he was going through his medical treatments, the highs and the lows, it was really special to be able to be within the circle for our colleague at some of the highest points and also some of the lower points of his time. And so, yeah, as everybody said, he will be greatly missed. And I do hope that his soul is finally at peace and no longer in pain.
Thank you. Thank you, Dr. Owens. Anybody else? Yes, in observance, his chair is empty this morning, but I like to think he's with us in spirit. And of course, we have the black bunting on the door, and he will be missed. Dr. Cleveland, you want to do the roll call?
I will. Dr. Lippincott.
Here.
Dr. Owens.
Present.
Dr. Givens. Dr. Kennard.
Present.
Dr. Dotson.
Present.
Dr. Loper. Dr. Gersh. Not here. Ms. Games. Mr. President, you have a quorum.
Thank you. I'd like to recognize Ms. Pamela Ratliff, who's our Special Assistant Attorney General, and she'll serve as hearing officer. And at this time, I'd like to provide anyone the opportunity for any further public comments. If none, we will proceed to the report from our Executive Director.
All right, so this is for July 16th, but it's reporting on May and June. And so in licensure, we issued 212 licenses through the traditional method. We issued 3 new podiatry licenses and 23 new PA licenses. Through the compact, there was an additional 211 licenses issued and 7 new letters of qualifications. And then we issued 393 certifications. In investigations, we received 106 complaints. We closed 29 cases, opened 12 new cases, with a number of total cases open at 47. Complaints closed within 7 days was only 50%, which you can see is down from 68%. And that's just been logistics of the time of year it is and people not being in the office as much because of vacation and things like that. We requested 19 PMPs, and on that, 15 of those required additional investigation. Now, I mentioned last board meeting that Jonathan Dalton and Deshae Khan had completed additional education and their courses, Mississippi Certified Public Manager Training and Administrative Services Certification for Deshae. I did not mention that Jackie and Anna had also completed certifications, and you can see it there in Administrative Services for Jackie and Supervisory Manager Program for Anna. And here is a picture of them at their graduation, and Jonathan served as class speaker for their graduation. So that's a long, far off shot of him at the podium, but that is him, I promise. Damn it. I can't seem to get everybody. All right. From now on, anybody finishing anything, let me know. So the medical board in action, Deputy Director Mike Lucius has officially retired as of June 30th. And I didn't create a slide for this, I meant to. So, but that does leave us now with 3 open positions that we're looking to fill. So Deputy Director is one of them. The legislature approved for us to have a second attorney to help Paul. So we're in the process of looking for that. And we also got permission to hire a communications officer to improve our outreach and education of the public as to what the medical board does on a day-to-day basis to help protect them and make sure that their doctor visits are safe. Anyway, so we're looking for those 3 positions, and we have taken applications on those and are going through them as we speak. Renewal season has finished. We started off, and I'll just go in the MD category, we started off with a little over 10,000 licensees and 93.7% renewed, which left us with 9,664. Now, of course, that number will grow throughout the year till we get back to well over 10,000. And then you can just see each one. I think the interesting thing here for me was that, you know, while only approximately 6% of MDs through the traditional licensing method didn't renew, almost 15% of compacts didn't renew. And so that's a disparity that's being seen across the United States. That's not just unique to us. And so, and then the same with DOs. And then we're not a member of the podiatry compact or the PA compact, but at some point I imagine we will be. I mentioned it last time that currently Shoba is our own. Ms. Gaines, I didn't call you in roll call. I'm so sorry. I did. Okay. Whew. I don't have a check by your name. So yeah, I sent out an email to all board members. I got a couple of responses, but I didn't know if y'all actually reached out to any of those people to see if they would be willing to serve or not. And so if y'all would follow up with me on that. And then, so if there are any questions.
So you mentioned the compact renewals and
Yeah.
the decline in compact renewals. What exactly is the rationale? Is it just because people had received them maybe during COVID or immediately post, and now they're not utilizing them, and so they're choosing not to renew? Or what exactly is the thought behind that?
So I have a couple of thoughts on it. I mean, I'm not sure if either one of them are correct, but one is, you know, a lot of people get their compact license because they've joined a locum tenens group, and the group goes, we need you to get licenses in all of these states, you know, and then that doesn't work out for whatever reason, or they find this just not their thing. And so then they don't renew in all the different states that they got compact licenses in. The other is, I mean, you're going to have a certain amount of retirement. And I do think that a significant number of compact licensees tend to be older physicians who are thinking they want to expand their horizons and do other things and then change their mind. So that's just thoughts on it. I don't know that that's a fact at all.
Okay, thank you, Dr. Cleveland. Any other questions? If not, the next item on our agenda is approval of the minutes of the Executive Committee meeting of May 21st. The minutes have been published, and if everyone has had a chance to review them, we can entertain a motion.
Are you gonna do, you want them all, or we do them one by one?
Well,
You need a motion, Dr. Clifton.
well, do we want to approve the Executive Committee and the Nominating Committee and the board meeting? And the, yeah, we have the Executive Committee of May 21st, the Nominating Committee of May 21st, and the board meeting of May 22nd. We can entertain a motion to approve all 3 of those if you'd like.
I'll make that motion, Douglas.
Second.
Thank you. We have a motion and a second. All in favor, please say aye.
Aye.
Aye. Any negative, any nays? If not, any abstentions? If not, the motion has passed. And now, next we have a report of today's executive committee meeting from our secretary, Dr. Gibbons.
Okay, as part of the executive committee report, the committee approved Dr. Richardson's request to resume unrestricted practice. A copy of the approved reentry plan is part of this report, and I ask that it be spread on the minutes. I also have a copy of this agreement if any of the members would like a copy to review.
Thank you, Dr. Gibbons. Next item is hearing in the case of James Leslie
Are we
Henderson.
gonna vote for approval for, I'd like to move that the report of the executive committee be accepted.
Thank you, Dr. Owens. Do we have a second?
Second.
We have a motion and a second. All in favor, please say aye.
Aye.
All not in favor, please say nay. Any abstentions? If not, the motion has passed. Now, we have the next item, number 10, which is a hearing in the case of Dr. James Leslie Henderson, and we have a request for a continuance.
Good morning. Dr. Henderson, this case has been continued a couple of times. I want to fill the board in because I'm going to ask that instead of a continuance, I'm going to request that the board stay this matter or agree to hold it in abeyance. Dr. Henderson, the charges are related to a loss of his privileges at Choctaw Medical Center. As part of his defense, Dr. Henderson has raised the argument that he was denied due process in the proceedings to take away his privileges. He has filed a defamation suit in federal court in which those charges, he is prosecuting those allegations. Under Mississippi law, when a physician alleges, or a licensee, really of any type, alleges that they were denied due process, then the licensing board would have an obligation to allow him to present that issue here before this board. Instead of having this board consider from scratch the issue of due process and hear from approximately 20 witnesses, his attorney and I discussed the possibility of simply staying this as opposed to coming back for a continuance every meeting, but simply to stay this matter and bring it back until we agree it's ready to bring back and place on the agenda for active consideration by the board. That will prevent the board from having to do this every meeting, and it will preserve his rights and preserve the board's rights to prosecute the charges against him. So I request that the board agree to stay this matter.
Thanks, Paul. So how are so once he has gotten his due process, this will come back before the board?
Yes, sir. His attorney has agreed to notify me, and of course, I check the status of the litigation once a month at least. Once there's been any decision, his attorney and I will agree, and we'll present this matter and ask the board to place it on the active agenda.
Okay, thank you. So we have a recommendation from our attorney to request that this matter be stayed or held in abeyance. So we can entertain a motion to stay this matter if you like.
I'll make that motion.
Second.
Okay, we have a motion and a second. All in favor, please say aye.
Aye.
Aye. All not in favor, please say nay. None. Any abstentions? The motion is passed and this matter is stayed. Next item on the agenda, number 11, is a hearing in the case of Dr. Mary T. Jacobson, and we have a request for a continuance.
Yes, I brought this matter before the board in May on a first request for a continuance. That was in error. We had actually not served Dr. Jacobson to give her the sufficient statutory time period required before the May meeting. So she technically did not need a continuance. Her attorney, Julie Mitchell, has requested a continuance for this hearing, and because of scheduling matters and the logistics of what we expected to go forward at this board meeting, we had agreed. Therefore, I would request that the board grant Ms. Mitchell's request for an additional continuance with the understanding that this matter will go forward at the September meeting. And I'll answer any questions the board might have, of course.
Okay, so this is actually the first continuance.
Yes, sir.
Okay, thanks. Any other questions or discussion? If not, we can entertain a motion to approve the continuance.
A motion approved.
Second.
We have a motion and a second. All in favor, please say aye.
Aye.
All not in favor, please say nay. If none, any abstentions? If not, the motion has passed and this matter is continued. Next item on the agenda, number 12, is the case of Dr. Ardarian, Darice, Gilliam, Pierre, and we have a request for a continuance.
Yes, Mr. President, this is a first request for a continuance. Dr. Pierre was served with ample notice for this meeting. She has requested a continuance to prepare for hearing, and we do not oppose that first request for a continuance.
Thank you. Any questions or discussion? If not, we can entertain a motion to approve the request for a continuance.
I'll make that motion, Dr. Lipcott.
Second.
Okay, we have a motion and a second. All in favor, please say aye.
Aye.
All not in favor, please say nay. Any abstentions? If none, this matter is, the motion to approve the continuance has passed. And next item on the agenda, number 13, is the hearing in the case of Dr. Elis Olson. I'm sorry. We're going to reschedule that for the last item. But the next item for informational purposes is a surrender of medical license by Dr. Rommel Asagwara.
Yes, Mr. President. I just want to make sure that everyone understands the status. This case has been an investigation for proceeding for approximately 2 years. And it was anticipated that this matter would be heard tomorrow and that it would be a lengthy hearing. Last Friday, Dr. Asagwara agreed to surrender his medical license in the state of Mississippi, never to request reinstatement or renewal, never to reapply. That surrender has been reported to the data bank, FSMB, and the other appropriate organizations. Therefore, Dr. Asagwara is no longer licensed in the state of Mississippi. Again, the board does not need to take any further action, and that surrender has also been published on the board's website as a public record of the state of Mississippi.
Thank you, Mr. Barnes. Any further discussion or questions from the board? If not, thank you, Mr. Barnes. Next item on the agenda, number 15, is a petition to lift restrictions of Dr. James Leonard Wootton.
And Dr. Wootton and his attorney are in the waiting room, if you'll let me bring them in.
I'll just make a comment.
Good morning. Good morning, Dr. Wootton.
Good
Um, Mr. Barnes, would you like to proceed?
Yes, Your Honor. This is Dr. Wootton's petition. I just wanted to make it clear for the record that Dr. Wootton is here and is represented by counsel. I'll allow to introduce herself.
Good morning. I'm Lorraine Boykin. I'm here today on behalf of Dr. Wootton.
We have a stipulation that I would like to place on the record. Our court reporter has not arrived, and we are unsure if we will have a court reporter here today. However, Dr. Wootton and his counsel have stipulated that with the approval of the hearing officer, they will accept the video recording of our live stream as the official record for this hearing, and we can have it transcribed later if anyone, would like to see it in print. So I would ask for Dr. Wootton and his counsel to stipulate that the recording will be the official record.
And as the hearing officer for the Attorney General's office, I've reviewed the rules and the statute. This is technically a not disciplinary matter. It is Dr. Wootton's request, a petition to the board for to lift restrictions. So it's not disciplinary. So I don't know that a transcript is required. Dr. Wootton will be placed under oath. Anybody giving testimony, I will swear them in. The matter is being recorded audio and visually recorded by YouTube. There's not an official transcript. The papers will serve as any record should there be an appeal of this matter, with the understanding that there is no court reporter transcribing this. And I would like to have both attorney and licensee to agree to that stipulation.
Lorraine Boykin here. We agree to that.
I agree.
Okay, thank you.
I yield the floor. Could we have Dr. Wootton sworn?
I was going to ask Ms. Boykin, who do you plan to offer testimony today?
Dr. Wootton.
And that's the only witness. If you would raise your right hand, we'll swear you in. Do you swear or affirm that the testimony you're going to give today is the truth, the whole truth, and nothing but the truth? Okay, thank you.
Ms. Boykin has requested that I give the board a brief overview of this matter. So if it please the board, Dr. Wootton, almost 4 years ago, was disciplined by this board for sexual misconduct. After a hearing, the board suspended his license and placed certain restrictions on his return to practice, which included a preceptorship undergoing an appropriate psychosexual evaluation, the normal requirements this board places on someone convicted of this type of offense. Dr. Wootton has come back before the board on at least 2 occasions to ask for greater geographical freedom as to where he might seek employment. Originally, he was limited to the state of Mississippi, and this board has granted that permission each time. It is my understanding, and I'll allow his counsel and Dr. Wootton to elaborate, but that Dr. Wootton has been unable to obtain a position in which he could comply with the board's requirements for return to practice as stated in the original order. Dr. Wootton is therefore petitioning the board to allow him to return to practice so that he can complete the requirements. And as far as the details, Dr. Wootton and his counsel are the best people to offer that information to the board. But I'll be happy to answer any questions you might have.
You may proceed, Ms. Boykin.
Good morning. I know he's provided you with a general overview as to the background of the petition and the request made by Dr. Wootton. If we can call Dr. Wootton for some questions now.
Yes.
Good morning, Dr. Wootton. If you would, again, briefly just introduce yourself to the board.
Dr. Cleveland, Dr. Lippincott, ladies and gentlemen, my name is Dr. James Wootton. Yes, let's see, it was in 2022 that I first came before this board. My license was suspended in 2023, and March of 2023. The board was gracious enough, and I do appreciate it, to reinstate my license. There were restrictions placed upon the license at that time. I have diligently sought to return to the medical field since then and have continued and have had trouble in doing so. The very first position that I attempted to get was through Indian Health Services. My family lives in Colorado. The closest reservation's just a few miles away. They were very interested. One of the restrictions on the license was no work with IHS. I then applied with Signify Health to do Medicare exams here in the state of Mississippi. That position could not move forward because of needing a chaperone with most female patients. I've applied with the VA. I've had two positions that have very much wanted me, but the VA requires an unrestricted license. I applied with a position in Biloxi with an AIDS clinic. They required an unrestricted license. Their clinical director was very interested, but their board required otherwise. As Mr. Barnes said, I came back before this board and asked for greater geographical area to work with. I've applied for licenses with the state of Louisiana, the state of Alabama, and the state of Kansas. In all three cases, I was advised to withdraw my request for a license with those states because it would not be granted. I'm sorry, my brain's kind of freezing just a little bit. I finally did manage to find a position with Northwest Mississippi Regional in the city of Clarksdale, Mississippi. In working with Signify in May of 2023, Medicare and Medicaid had both been revoked due to the license suspension in 2022. I worked with both Medicaid and Medicare in the summer of 2023 to reinstate Medicare and Medicaid both. When Northwest finally ran my credentials in May of 2024, it triggered something at Medicare, and my Medicare billing privileges were revoked again. In total, I've had to reapply with Medicare and Medicaid 3 times in the last 2 years. I have found out in the process that Blue Cross and TRICARE will not credential me without an unrestricted license. So there is a billing issue to all of this. After leaving the employment of Northwest Mississippi Regional, I applied with all the other clinics in Clarksdale, the neighboring towns of Cleveland and Tunica, and wasn't able to move forward with any of those either. Through Indeed and Doc Cafe, I've applied to just about every open position from South Haven to Biloxi in this state. I've had a few very nice interviews, but nothing that has moved forward once they found that my license had restrictions on it.
And Dr. Wood, not to interrupt you, but just to make sure that that's clear for the board's understanding. So have you been able to work as a physician at any time since your license was reinstated?
I worked for Northwest Mississippi Regional for about 3 weeks. And then the billing issue came up and I was terminated. And that billing issue was directly related to the restrictions.
And have you been able to have any other type of employment outside of medical practice since then? If you'll tell the board about your attempts to work outside the medical.
Yes, ma'am. I haven't just focused on finding a job in medicine. I spent in 2022 and 2023, I spent a year working for my family's business, a small winery in Colorado. And then my wife got her dream job in Huntsville, Alabama. So we all moved to Huntsville so that she could have that job. And I spent a year working night shift for a gas station, just doing menial labor. And then after moving to Clarksdale and things falling apart with the hospital, I've spent the last year with a funeral home there, being a part-time apprentice funeral director. And I have applied, let's see, I took and passed the Mississippi Insurance Property and Casualty exam, and have applied to multiple places in the insurance industry and have not been able to move forward with that because I have lots of job experience and no experience in the insurance industry. I've applied to multiple community colleges to teach, but without a master's degree, that's not moved forward. In Clarksdale, I took my resume to the local schools and to offer to be a substitute teacher, and no one ever called me out for that either. So I've both actively pursued positions in medicine and actively pursued positions outside of the medical field, and just not seem to be getting very far. Along the way, that has caused financial hardship. We've lost 2 houses. We've lost 2 cars. We've been homeless twice. We scrape and pinch pennies, and we were on food stamps for a short time. My lovely wife, who came with me today, has been the primary breadwinner for our family for the last 2.5 years, which I'm very proud of her. She's been very strong. But that was never what she was supposed to be. It was supposed to be on me, and I haven't been able to do that. When Mr. Barnes introduced what happened, yes, I made a terrible mistake. What I did was immoral and unethical and unprofessional, and I embarrassed myself and I embarrassed our profession. The pain that we have lived through financially, mentally, emotionally in the last 3 years, it is never worth repeating. I beg you to please lift these restrictions. Personally, I agree with them, but they've forbidden the ability to move forward professionally. If you will lift them, I will do my utmost to continue to live by them anyway, live by them as a good professional way to move forward. But the formal restrictions on the license have prevented being able to take care of my family or be able to serve the great people of this state.
Based on the information that's provided by Dr. Wootton, that provides an overview of the hardships that his family's experienced, the inability of him to be able to practice medicine really in any capacity in this state. And because of his extreme experience in one field, yet lack of experience in others, it's been difficult for him to find employment anywhere else. And based on all of these things, we come forward and request that the board remove the restrictions as they are on his license.
Mr. Barnes, do you have any questions?
I did briefly. Dr. Wootton, there are times when the board grants a physician an unrestricted license, but enters into an agreement or a reentry plan or program with a physician. So the status of their license shows as unrestricted. Would you be willing to consider entering, if the board were to offer you that chance, would you be willing to entertain such an agreement that might include some of the requirements, such as, like a chaperone or a preceptorship?
Yes, sir. Like I said, I'd be more than happy to live with the restrictions, formally or informally, um, with the board or through the PHP. But the formal restrictions on being on the license have just made it impossible to move forward. But yes, I'd be willing to do that.
No further questions.
Uh, Dr. Wootton, could you remind us about your education, training, and work experience, please?
Yes, sir. My education and training in family medicine were both with LSU Health Sciences Center in Shreveport, where I worked hard, and most of our patients were low socioeconomic ability. And so my training was to be there and take care of patients, no matter who they are, what they are, how much they make, whatever they do. That's the job in family medicine, is to take care of everybody.
And what year did you finish your training?
I finished med school in 2008 and finished residency in 2011.
And what did you do following residency?
Following residency, I spent about 4 years working in a walk-in clinic, doing 12-hour shifts, and then a couple of other positions that were in just clinical, daily, regular family practice medicine.
And the 3 weeks that you were at the Northwest Mississippi Regional Clinic, what was your work there?
My job was to take care of patients and treat them, just, standard family medicine, follow up on blood pressure, diabetes, health screenings.
Has your work been mostly outpatient?
Yes, sir.
Yeah, and when was you were when were you at the Northwest Medical Clinic?
Late April through about halfway of May of last year, 2024.
Okay, and do you have any board certification?
I am certified through the National Board of Physicians and Surgeons,
And what are you certified in?
family medicine.
Okay. And do you have to maintain certification in that?
Yes, sir.
So you're
They-
you're currently board certified?
I am currently board certified.
Okay. Um, um, okay, does the board have any other questions for Dr. Wootton?
Hi, Dr. Wootton. Thank you for coming today. My name is Dr. Renee Dotson. I'm from Greenville, Mississippi. The past, the restrictions on your license also, they require that you have a chaperone, a lot of physical things, but they also require that you do some personal work. Can you tell us a little bit about the things that you have done as far as counseling, as far as working toward the courses that were required as a part of the restrictions? What self-help have you done during this time?
Yes, ma'am. In 2002, prior to the reinstatement of the license in 2023, sorry, that should have been 2022, not 2002. I apologize. Prior to the reinstatement of the license in 2023, I took CME courses in proper medication prescribing, particularly opioids, and proper record keeping. Throughout 2022 and part of 2023, I was seeing a counselor on a monthly basis. That's been almost impossible to maintain without financial resources. Counseling is very expensive. However, I've continued to seek pastoral care in the churches that we've attended, just to make sure that I'm keeping up with somebody and talking through how I'm feeling and looking towards the future, making sure that what's happened in the past does not get repeated. And then I did spend 9 weeks in total treatment with the professionalism program through Pine Grove in Hattiesburg.
Does anybody have any further questions for Dr. Wootton? Not, if not, um, Ms. Ratliff, what's the next?
No further questions. Any other statements, Ms. Boyd? Any follow-up?
No.
Okay,
Nothing further.
okay. I'll turn it over to the board then.
Okay. So, we've heard testimony and, asked questions and, if we, in this matter of the petition to lift restrictions of Dr. Wootton, are we ready to entertain a motion?
I move that we close the meeting to consider whether to go into executive session on this matter.
Second.
We have a motion and a second. All in favor? Aye.
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 Any opposed? Any abstentions? If not, the motion is passed. We have a motion to go into executive session. And the meeting is, well. of the board?
Yeah, good afternoon. In the matter of Dr. James Wootton, coming out of executive session, the board grants the removal of restrictions and grants an unrestricted license conditional upon completion of the board-approved reentry plan, as well as affiliation with the Mississippi PMP for a minimum of 5 years. I'm sorry, PHP, sorry. Yeah, PHP for a minimum of 5 years. And any further questions can be directed to the executive director regarding specifics.
Thank you, Dr. Givens. And any further questions, and please follow up with our executive director next week. Yeah, you understand that this is contingent upon a reentry agreement that we work out with that Dr. Cleveland will arrange for you, and affiliation with the PHP for monitoring for at least 5 years. Yeah. I will take a poll. We have a couple of more items on the agenda. Do we want to approve? Do we want to? We have a item. The next item is an investigative subpoena for approval. Do we want to do this before lunch? If so, I'll entertain a motion. Mr. Barnes.
I was just asking, I was sorry, excuse me, for scheduling purposes, our court reporter is going to be participate for Dr. Olson's consent order, which is the only remaining item. And Dr. Olson will not be appearing, but our court reporter is going to be participating by Zoom, and so she can be ready by 1 o'clock. So if the board would, either way you want to do it, if you want to go ahead and do the subpoena, or take the lunch break first, if you would take the lunch break, that'll allow us to complete the agenda. And I can see some questions on some of the board members about the court reporter. That was a technical glitch on our part, where we didn't have our court reporter properly set up for today. And that's a statutory requirement that for a disciplinary hearing, we have a court reporter. So that consent order is the only other matter of business other than the subpoena that you mentioned.
Okay, well, we might as well go ahead and take care of the investigative subpoena. Do we need a motion to go into executive session?
So move to close the meeting to consider whether to go into executive session on the matter of the investigative subpoena.
Second. We have a motion and a second. All in favor, say aye. Aye. Any opposed? Any abstentions? The motion has passed. The meeting is closed. And we'll findings of the board in executive session?
Yes, in executive session, the board approved the investigative subpoena 2025-060.
Thank you. And the next item on the agenda is the meeting dates for September. The proposed dates are Wednesday, September the 17th and Thursday, September the 18th. Are those okay with everybody? I think that's the usual.
September 17th, 18th.
Yeah, that's the usual third Wednesday and Thursday. We could stick with that.
I have no travel that I have blocked that and
Okay, well,
protected
good.
that
Well,
time.
we'll maybe we can plan on that then. And we have one remaining item for after lunch. So I think that if everybody's okay with those dates for September, I think we can okay. All right. Well, thank you, everybody, and we'll be adjourned for lunch until 1 o'clock. We're gonna reconvene the Board of Medical Licensure. And the next item on the agenda is Dr. Elis Olson, approval of consent order. Paul?
Yes, sir. And before we start, I'd just like to confirm that our court reporter, Ms. Amanda Wootton, can hear us.
I can. Can y'all hear me?
Yes, ma'am.
Okay, thank you.
Thank you. This case started about 18 months ago. Dr. Olson was charged in December of 2024 with violation of the telemedicine regulations, failing to establish a legitimate physician-patient relationship, failing to, during telemedicine, failing to perform any required lab tests, failing to properly communicate with the patient was the essence of the charges. The summons and affidavit, charge and affidavit are available in your materials. Essentially, there was an adolescent patient who was suffering from symptoms, flu-like symptoms. Dr. Olson, who has never physically practiced in Mississippi or been located in Mississippi, through telemedicine, had a visit in which he spoke to the patient's mother, obtained any information that he'd received directly from the mother, never communicated directly with the patient, and prescribed, I think it was Fluzone, one of the flu medications, did not perform or have scheduled any tests, flu test, COVID test, strep test, et cetera. Dr. Olson, after extended negotiations, has agreed to accept a 3-month active suspension of his medical license to begin the day that the board, if the board accepts the consent order. Dr. Olson allowed his license to expire on June 30th, 2024. And it is our understanding he does not plan to renew. However, as I'm sure the board is aware, you can't escape discipline for actions you took while you were licensed in a state by failing to renew your license. So Dr. Olson was charged in December. There have been several continuances. The most recently was because of a serious illness of his attorney, Philip Hearn. However, Dr. Olson has signed the consent order that's in your materials, and we request that the board accept this 3-month suspension for Dr. Olson, and it also includes a CME in medical ethics. Yes, ma'am.
So can you just, for purposes of clarification, explain how this works in a non-renewal setting? What, just from a procedural standpoint, how exactly does that work?
Federal law that established the data bank and the federal regulations that govern the data bank make failing to renew or allowing a license to expire while under investigation to be a reportable offense. And therefore, again, you can't escape the consequences. Dr. Olson we could have simply reported this in that way to the data bank. We felt it was important that the details, though, of the offense be made public record. If we had just reported that he failed to, that he allowed his license to expire, those details would not be public record. Yes, ma'am.
So the follow-up to that is, based on what you've said, then the understanding is that, so he is aware of this and is also aware of the potential implications of non-renewal and has chosen to still allow it to lapse. So this is not somebody who 5 months from now or 6 months from now, you're expecting to get a renewal.
No, ma'am. It is our understanding that this particular physician is going to retire permanently from the practice of medicine.
Excuse me, this is the court reporter. I'm not getting who's speaking. The first person that asked the question was who, and then the second person who asked the question was who?
So the first and second person were the same, and I'm Michelle Owens, and I'm a member, and that my conversation was directly with Mr. Barnes.
Thank you.
Yes, my name is Ken Lippincott.
Hello, Dr. Lippincott.
President of the
My name
board.
is Paul Barnes.
And is there any further discussion? I have a question. If Dr. Olson, his license has expired and we have a consent order, what are the consequences if he fails to complete the consent order?
We would report that to the data bank. There would be a second report to the data bank.
So what have we already reported to the data?
We have not reported anything until the consent order is either approved or not approved and set for hearing. We will not report to the data bank.
But Dr. Olson has allowed his license to expire while he's under investigation. Is that not reported?
He has, it's not automatic. In this case, because the investigation was still ongoing, under the data bank regulations, until an investigation is completed with either dismissal, a consent order, or a hearing to resolve those charges, then the investigation continues, is not considered complete. It's only after that is the investigation is considered complete that we have a 30-day window in which to report the action.
So we've had several orders of continuance, but do we have any documentation of communication with Dr. Olson or his attorney?
We do. I do not believe we placed them in the book. We
So-
have emails, and there were phone conversations between myself and Philip Hearn, his attorney. There are also emails between myself and Mr. Hearn where he requests, he stated that his client would accept the terms we had previously discussed. I put those terms in this consent order, sent it to Mr. Hearn, and he returned it with Dr. Olson's signature.
So Dr. Olson, he has signed the consent order.
Yes, sir. And the copy that's in the materials may not have the signature on it because when we were putting together the book, I don't believe that we had that yet. We do have the signed copy and we'll substitute that for this unsigned copy that's in the book.
Okay, thanks, Paul. Does anybody else have any questions or further discussion? In this matter of approval of the consent order for Dr. Elis Olson, do we have, I think we can entertain a motion.
I make a motion to accept the consent order given.
Second.
We have a motion and a second. All in favor? Any further discussion?
The second is Kennard for the court reporter purposes.
Okay.
And who made the motion?
Given.
Givens.
Thank you so much.
Okay, we have a motion and a second. All in favor, please say aye.
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 Any opposed? Any abstentions? If not, the motion to approve the consent order is approved. So, is any further business?
No, sir. And I just wanted to thank Ms. Wootton for getting on as our court reporter,
Yes.
and appreciate her very much.
Yes, thank you, Ms. Newton.
Thank you.
And any further business for the board? Would like to thank everybody for your attendance and participation. And this meeting of the board is,
Motion to adjourn?
motion to adjourn.
Second.
Thank you.
A second.
I'd like to thank the parliamentarian. All in favor, say aye.
Aye.
Any opposed? Any abstentions? But meeting is adjourned.
I need you to check your schedule.